Good afternoon and welcome. My name is Barbara Fox de Mayo Caprilli. I'm using all of those. And I thank you for your interest in my research. I will be speaking to you on the effect of menopause on the elite singing voice. Why this subject? I am an elite opera singer, a dramatic soprano, and experiencing menopause. I teach menopausal women, and there is a scarcity of research on the elite female singing population. Methods used by elite singers to maintain their voices during menopause could be helpful to other female singers and teachers of singing. Why is this important? Every female singer will experience menopausal changes, providing, of course, they live long enough, some more than others. Several studies, including those by Abitbol in 98, 99, and 2006, and Sadloff in 1996 and 2006, examine menopausal effects on the singing voice, but no studies focus on elite singers. Strategies gleaned from the experiences of elite singers could be helpful to avocational and vocational singers during menopause. Common physical effects of menopause include the vasomotor symptoms, the famous hot flashes and night sweats, emotional symptoms such as diminished energy and drive, mood fluctuations, irritability, tension, apprehension, headaches, loss of libido, and insomnia, most of which I have experienced, by the way. Musculoskeletal symptoms include skin and breast atrophy, vaginitis, hirsutism, that means more hair, thrombosis, degenerative arthritis, and osteoporosis. Common vocal effects of menopause include dryness, frequent throat clearing, lower fundamental frequency and reduced vocal range, voice sound alterations with increased roughness and hoarseness, and vocal wobble. I've included in this PowerPoint a picture of the larynx so that you can see some of the cartilages that I will be discussing. There is the thyroid cartilage, that's the big one right here, and the cricoid cartilage, which is right under here, the hyoid bone, which is actually right here underneath it, you can't see it in this particular picture, and the arytenoid cartilages, and those are right here at the back. And this is looking from the front. This is the front of the larynx, and this is the back. The vocal folds are also affected in menopause, so I thought I'd include a picture of those as well. The epithelium, which is the covering of the vocal folds, gets thicker as estrogen leaves the building. And the thyroarytenoid muscle, which is in the center of the vocal folds right there, is also affected as muscles, all muscles in the body are affected. Hormonal issues. The lack of follicles in the ovaries causes a radical drop in the secretion of estrogens and the complete halt in the secretion of progesterone. This may cause poor response time in the vagus nerve that largely innervates the larynx, thickening of the epithelium, atrophy of vocal folds, vocal fatigue, and Rinke's edema. Rinke's edema is when that top layer of the vocal folds gets swollen and floppy. It happens also to smokers. Abitbol in 1999 reported that about 20% of the professional singers in their study had symptoms serious enough to merit treatment. Effects of presbylaryngis, that means vocal aging, causes changes in laryngeal cartilages and joints, the intrinsic laryngeal musculature, that's the stuff on the inside, vocal fold epithelium, and the laryngeal innervation. Also, the elastic cartilage of the larynx, the vocal process, the apex of the arytenoid cartilage, the cuniculate, and the epiglottis do not ossify during normal ossification. Ossify means get like bone, turn into bone. But the hyaline cartilages, which is the thyroid, the cricoid, and most of the arytenoid, do eventually ossify. This complex mechanism is in a constant state of change from birth to death. The hyoid bone starts to ossify at the age of 2, The cricoid and thyroid cartilages begin to ossify in the 20s, and the arytenoids cartilages ossify in the early 30s. Except for the cuneiform and corniculate cartilages on the thyroid cartilage, the entire laryngeal skeleton ossifies around the age of 65. That's for both men and women. Ossification may actually be beneficial to the larynx in the 3rd decade, which is when an elite singer's voice is at its peak. Ingo Tietze, very important voice pedagogue and voice scientist, speculates that a partially ossified laryngeal framework can better support the tension of the vocal folds because bone tends to deform less than cartilage under the same stress. It is important to maintain rigid endpoints for tissue fibers to vibrate in simple, predictable modes. Now, this is probably why the dramatic voice, the heavier voices, do better as they get older. I chose to use qualitative design. The methodology includes interviews with 14 elite singers and 5 voice professionals. And of those 5 voice professionals, 3 were singing voice specialists who worked with ENTs, that's voice doctors, and 2 elite voice teachers. Elite singers, for my study, I defined them as opera singers who have sung in A houses and musical theater singers who have sung on Broadway. Elite teachers obviously teach the elite singing population. I was unable to identify any research that dealt with a truly elite singer. There were problems with all of the studies I looked at. Some of them had singers that I would not at all call elite. Others had problems with their gathering of material so that you could not confirm that they were elite singers. Interviews were conducted in person or via Skype. All were digitally recorded. Informed consent was obtained. The digital recordings I transcribed myself, and all subjects were asked the same questions. The questions were open-ended, and the responses were coded and analyzed using the qualitative research software Deduce. The purpose of this study is to determine the voice and physical changes a group of elite singers experience due to menopause, how these changes have affected their careers, and what strategies have been helpful as they negotiate this time of life. Furthermore, the study gathers pedagogical strategies reported by elite singers and voice pedagogues as methods of treating and managing menopausal vocal changes. My guiding questions: what vocal changes do elite singers attribute to menopause, aging, or both? What physical changes do elite singers attribute to menopause, aging, or both? And what pedagogical strategies do elite singers and voice professionals recommend for treatment and management of menopausal voice vocal changes? The interview participants included 6 operatic sopranos. I've coded them so that you can see on the PowerPoint as OSOP, O-Miz for 3 operatic mezzos, just to help you keep track of who's talking. 4 Broadway sopranos, 1 Broadway lyric mezzo belter. I also have 2 singing voice specialists who are SVS and 2 elite voice teachers, EVT. All the participants were female. That may seem like an obvious thing to say, but also the voice professionals were all female. 4 singers were between 50 and 60. 6 singers were between 60 and 70. 3 singers were in their 70s, and 1 singer was in her 80s, 83 to be exact. 3 out of the 5 voice professionals interviewed were also postmenopausal. In this PowerPoint presentation, I'm using pseudonyms for all of the participants, but in my written dissertation, the participants were assigned alphanumeric codes, such as S1, S2, S3. My first topic is vocal change. Changes common to all the participants include dryness, passaggio problems, changes in range at the top or the bottom of the voice, issues with vocal flexibility, stamina, and breath management. The singing voice is generally recognized as comprising 3 registers: high, middle, and low. The passaggio is the point at which 2 of them meet. So the two major transition points in the female voice, the passaggi, are most frequently found between C4 and G4 and D5 and G5. Now I'm getting into, one of the things about qualitative research is that we want to hear the voice of the participants. So there will be a lot of reading of what they actually said as part of this presentation. Mary said, if I'm doing an arpeggio coming down and I hit that G, it might go flat, it might go woo! Laura said, some singers are scared to change that passaggio a little bit. They don't, and then they carry up too much weight in the high voice, and it's a big problem. Laura, as well as many other singers in this study, are also voice teachers, so they sometimes lapse into pedagogical statements. Anna says, the lower passaggio does not cooperate the way it used to and goes ka-chung. On lots of high notes, Elizabeth said, you can play all sorts of games, but the voice is going to lose a little bit on the top. You feel that the voice is not flexible enough to carry the weight that has come into it, even if you are singing with the very best technique and you're thinking about it all. It's like walking on eggshells. Laura said, my voice is lower today. As you mature, you lose the elasticity to go into the top. Carol said, I can understand now why Maria Callas dropped down to Carmen and changed her range. At the time I thought, what is she doing? And Kathy said, my high notes are not as available because I always lived very high. It's harder to go above there, although I can. It sounds okay, but it's very soft. One of the interesting things that came out of my study is that the 3 operatic mezzos that I interviewed reported a loss of low notes. This was not something that I found in my research, but it was common to all 3 of the operatic mezzos. Bobby said, my best range has gone up slightly, and it's hard to distinguish this from the effects of teaching and demonstrating, with an extension on my upper range that perhaps unbalanced my voice. I prefer to sing in that upper mezzo tessitura, not opposed to even attempting something with a slightly higher tessitura, but I will never call myself a soprano. And Anna said, most of the people I've talked to say that their voice goes lower, and my voice is going higher, and it's pretty annoying, because I'm not going to get hired for soprano roles at this point in my career. So it's really subtle, but I notice it. It just sits more comfortably higher. A more common situation that I expected to find from my research is the strengthening of low notes. None of the 6 participants who reported lowering of the voice used hormone replacement therapy. Darla and Dia both saw this as a positive change, that their voice lowered. Darla said, I feel that I'm more of a bass in the morning and could probably go down to the octave below middle C. And Dia said, you know, one of the good things of age is that, especially for a coloratura, you get a little warmer in the middle than you had before. Vocal thickness and the loss of flexibility was reported by several of the respondents. Abitbol found that women have less supple vocal folds with a thinner mucosa and reduced vibratory amplitude, and that although the cricoarytenoid joints moved normally in menopausal women, the motion often diminished after the age of 65 years with loss of the suppleness of the ligaments and some arthrosis. Jane, Darla, Carol, Jackie, and Laura repeated a feeling of thickness or heaviness in the voice, especially in the middle. Jane, Elizabeth, Bobby, and Laura reported a loss of flexibility. Stamina and breath management. Both men and women lose stamina as muscle and neural tissues begin to atrophy and the chemicals involved in nerve transmission change. The lungs lose elasticity as they age, and the loss of estrogen and progesterone has a substantial negative effect on muscle tone in menopausal women. 6 out of the 14 participants reported this issue. Laura said, the things that you had stamina for in your youth, perhaps now you have to go back and re-gauge it and work yourself up to the stamina that it requires to do it, both vocally and physically. Angela said, the main thing is what you do physically, vocally, the color of the voice, all of that stuff is the same. It's just you have to work a lot harder physically. And Jackie said, your basic energy, your ambition to do things, there's that feeling of been there, done that. Slowing of the vibrato rate is common in aging voices. That's across both men and women. This occurs in both men and women, and although hormones might be a factor, it may also be affected by the weakening of the muscles and sinew that supports the larynx. 2 of the respondents reported this issue, but 4 of the voice professionals reported it in their patients. Research by Abitbol, Sadaloff, and Dassler et al. Suggests that the slowing of the vibrato is a much bigger problem than the singer interviews might indicate. It's also one of those things that singers don't like to talk about. So, Teresa says, vibrato problems in patients are something that comes up very, very often. The vibrato is unwieldy, out of control, or excessive. Maintaining pitch. This was another outlier among my respondents. One of my respondents has perfect pitch, and she feels like she's losing it. Now, Liu et al. Found that the control of fundamental frequency is important in the control of pitch and singing. Their study, using adults between the ages of 19 and 75, showed a significant effect in age in response times, reaching a maximum at 51 to 60 years of age. Pitch control issues can be caused by encroaching deafness, of course, as the synovial joint in the middle ear ossifies and loses its suppleness. I will say that I have found since writing this paper, I've been informed of studies on this, but as far as I know, not with elite singers. It's kind of rare for an elite singer to have perfect pitch. It doesn't happen very often. For anyone to have the perfect pitch, actually. Betty said, but I really think that the most common problem is weakness, that the vocal fold, one or both, just doesn't stay strong, and that it manifests as a lack of ability to stay on pitch. I looked into the change of repertoire, and the first subject is the change of repertoire due to vocal issues. Mary said, I'm looking at some repertoire and saying, I'm probably not going to be able to sing that, and not because the range isn't there, but because of the fila di voce issue. That means the ability to sing a long line and soft as well. Jackie said, I would say the approach to them, the high notes, is a little heavier than I would like. In fact, that is why I also stopped singing that role as much. She named a role there that I did not include in order to protect her anonymity. Kathy said, if you don't have the high silvery ease, you just don't do songs that require that, of course. Anna said, what's frustrating is that the things I do get are low and it's not comfortable. Anna's one of the mezzo-sopranos. Laura said, I can no longer do the really high parts. I mean, it was hard to. Your voice just gets more cumbersome. A far more common reason for changing repertoire was the change of repertoire due to age or appearance, or both. Almost half of the singers interviewed changed repertoire because of age and appearance. All of the voice professionals reported that they had recommended repertoire changes to singers over the years. Angela says, so what I've done is to change to age-appropriate repertoire. Dia says, when I do concert or cabaret, you can still sing the I'm Gonna songs instead of just the songs of bitter regret. Elizabeth said, I had a great ride on the carousel, and I got off while I felt that what I had sung represented me in what I looked like and what I sounded like. A few of the singers reported no change of repertoire. Bobby said, you know, I've not laid any singing career issues at the door of menopause. Debbie said, yes, you have to remember that I'm musical theater, but I sing soprano musical theater with no problem. So no, absolutely no changes in rep for me. Carol said, I was singing at New York City Opera, and then I left the City Opera because I got to the point where I said, is this all there is? Carol was an outlier in that she left her career for reasons other than voice. She just got tired of singing opera, basically, and wanted to do something else after having an international career. This is an interesting comment on change of repertoire that I wanted to include. Bobby said, so many of us get identified with a role and we are loath to give it up, or we feel that we somehow really failed and we can no longer perform to the degree that brought us to prominence. Then there is always that wistfully looking back and going, I could really do that then. I think that women going through this time should just relish the fact that there is a vast repertoire for us to continue to explore. This leads right into emotional issues. Bobby said, when you're not fat anymore, you're not going to put that costume on again. What does that mean? And Mary said, every day I wake up and I thank God that I can still sing, because honestly it scares me to think I'm not going to sing anymore. And then she added, it seemed to me that just the whole act of singing just became more difficult. Carol said, I've lost my passion. I want my passion back. Jackie, another thing that goes with aging, your basic energy, your ambition to do things, there's that feeling of been there, done that. And Anna said, I take antidepressants, so that could mask any other craziness that's going on. The next group of interviews talk about physical symptoms. Men begin to feel the effects of age on the voice when they are around 60 years of age, but in women the aging of the voice is more closely related to menopause at approximately age 50, although symptoms can begin as early as age 35. Voice scientists disagree on how great an influence hormones have on symptoms that are considered to be normal aging. Darla developed fibromyalgia after a car accident and felt that this condition masked her menopausal changes. Jane developed asthma living in New York after the attack on the Twin Towers on September 11th and questioned whether her issues with breath management were related to that asthma or rather than in menopause. Elizabeth developed heart problems that influenced her decision to leave a full-time career. Physiological changes. Bobby said, I think I went through menopause in my mid-40s, sort of earlier than some people have experienced it, and that was precisely the time, not by any design, that I started teaching full-time. So whether teaching brought on menopause or it was the age thing, those two things kind of coincided. Although hot flashes are the most frequently reported symptom of menopause, few of the participants reported problems with them. Vocal fold weakness came up. That's because estrogen deprivation can cause substantial changes in the mucosal membranes of the vocal tract, vocal musculature, and systems throughout the body. Vocal fold weakness was reported by 3 of the 5 voice professionals. And in fact, Betty said, most of the problems have been with people who have experienced vocal fold changes. And because of these changes, the voice got weak, or it got unsteady, or it became uncontrolled and was unresponsive, even in highly trained, highly experienced vocalists. On to hormone replacement therapy. 5 singers who used hormone replacement therapy, or the homeopathic equivalent, reported no vocal change. Jackie said, I would say that my voice is not that much different, but my apparatus is a little drier. And Angela said, so the change vocally, the color of the voice, all of that stuff is the same. It's just you have to work a lot harder physically. Joan said, I don't really have an awareness of any major changes. Debbie says, it's just the same. And Dia, who was using a homeopathic regimen that induced her body to make the hormones that she needed, said the voice is better. Treatment and management. The voice professionals had some very interesting comments on menopause and aging. Betty said, I think that the women I'm speaking of were all women who were of the age where they already had gone through menopause, and I do not think they knew if it was age-related or if it was menopausal-related. Teresa said, I work with women who have a clustering of symptoms, some of which are consistent with what people have reported with menopause, and some of which are consistent with what people have reported in aging. She was very hesitant to give me any firm opinion on this. Frances could not exactly correlate the changes with menopause, but noticed that women who begin to experience perimenopausal symptoms and coincidentally begin to note some vocal instability or changes, she said that when that happens, I can say with certainty that I have noted consistent struggles in women's voices who are postmenopausal. Use it or lose it. This is something that almost every person reported, almost every respondent. Frances said, I've noticed that after a certain age, between 50 and above, there seems to be a smaller margin of error in the entire mechanism, and there is a need for vigilant maintenance in terms of vocal exercise, in other words, practice. Mary said, I think the main thing that I've learned through all of this is, number one, you have to keep singing. Laura said, if you don't use it, you lose it. If you don't use your voice, you lose your voice, because so much of what we do in our business is muscle memory. Many of the singers addressed exercises that help to keep the head mix healthy. This was the number one suggestion. Kathy suggested register work using nonspecific note exercises such as hooty-oos, that's woo on slides, also known as a siren, when you go woo woo woo, that kind of exercise. And an open mouth hum, which is also that kind of thing. It's called a hung or an ng for head or whistle register. And jaw loosening yahs on a descending 5-tone scale for middle voice work. Most of the exercises address the head voice. Teresa outlined specific passaggio exercises, including a lot of gliding and the mezza di voce and the little straw. So any of these things, the hung or the little straw or lip trills or lip buzzes or tongue trills, all of those things are what we call semi-occluded. They close a little bit of the vocal tract and they help the vocal folds to operate more efficiently. Barbara Doscher, an important pedagogue who wrote one of the most important pedagogy tomes that we have, which is called The Functional Unity of the Singing Voice, said that considering the variability of breathing practices, it is probably well advised to admit that from an empirical point of view, and probably from a scientific one as well, there is no set formula for ideal breathing that will fit every singer. And this might be considered a little bit unusual because most voice teachers think that they know how to teach the only way to breathe. So this was a very important statement. Aging has a profound effect on the pulmonary function. The trachea softens and widens, the peribronchial muscles atrophy, and the pulmonary alveoli. I'm now experiencing something called vocal diakinesis, which is something that goes along with menopause. That's the inability to say things clearly, so I apologize for that. And the bronchioles dilate. The alveoli also thicken and develop more capillaries, causing problems with oxygen diffusion in the lungs. Vital capacity can reduce by as much as 40% between the ages of 20 and 80, along with the deterioration of the forced expiratory volume, tensile strength, and elasticity of the lungs. Kathy said, keep that balance going, and in anything you sing, make sure that it is very well supported and that the support is not confused with just tension, but really a tactile, a tensile strength. Frances said, the vocal folds and the airstream do this intimate little thing. They're very codependent, and when one of them gets soft, the other one gets all confused. Robert Edwin, who is a very important pedagogue, voice pedagogue, said this about physical fitness. Muscle and neural tissues atrophy, and the chemicals responsible for nerve transmission change. Ligaments atrophy, and cartilages turn to bone, including those in the larynx. Joints develop irregularities that interfere with smooth motion. Regular exercise can help to delay or mitigate these symptoms. Jane, who is still singing professionally, said, that's what enabled me to sustain the line that I have, because I'm in better condition physically than I've been in a long time, and that's because she was in a very demanding show, a physically demanding show. Mary said, I find that my mood and my physical self, and even in terms of having hot flashes and things, are better when I'm working out, even if it's just a walk around the block on my lunch hour. I'm now ready for my discussion. My participants reported the following vocal changes attributable to menopause, or what they felt were attributable to menopause. Dryness and vibrato issues seem to be related to normal aging. Only those participants not on hormone replacement therapy reported a loss of flexibility, passaggio issues, loss of range, and in the operatic mezzos, they reported a loss of low range as well. But this cannot clearly be linked to menopause because one of those operatic mezzos was indeed using a hormone regimen, so that's not clear. Physical changes attributed to menopause. The change of career was attributed to aging-related issues such as medical problems and appearance by all of the participants except one, S5, S5 is what she was on my paper, who left an operating career several years before entering menopause. And that's the one that I told you about that was singing an international career, sang at City Opera, and then one day just walked away. Anna, who's one of our mezzos, said, "There's a stigma right now about age, I tell you. I'm hardly singing at all, and the only thing I can think is age, though I'm still able to sing great." And I've heard her, she's right. She sings great. Pedagogical strategies for the menopausal voice. One-note half-step and slides using semi-occluded techniques such as straws, lip trills, etc. were highly recommended. Arpeggios and onset exercises, that would be things like ha, 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 those are onset exercises. Stretching the voice into both head and chest register every day and singing repertoire every day. My suggestions for further research. A longitudinal study with regular testing of hormone levels starting before the onset of menopause, around age 35. However, it would be difficult to find elite singers who could make the time commitment such a study would entail. An anonymous survey. I found that a lot of people that I have worked with who were hesitant to do a formal interview, but they said that they would offer to do an anonymous survey should I ever design one. A study following women who began hormone replacement therapy after menopause. This was suggested actually by one of my singing voice specialists. We need to find out if the low note loss issue is operatic mezzos is common or if that was just an outlier of this research. And also, is the loss of perfect pitch common? Debbie gave me a quote which very nicely sums up why I began this research. "You feel like a woman with no feet if you can't sing. It's something that's taken away that is so much a part of you. Other than severe illness, I cannot see why it is not possible for every woman at every age to continue singing. I mean, you'd have to convince me that we have to suddenly become mute." And Frances ended up summing up the results of my research very nicely when she said, "This may be the one single thing that comes out of your study that is conclusive, that some women seem to experience problems immediately following menopause, and you could conclude intuitively that it may be related to the menopause or the cessation of hormones, whereas some women don't even notice a glitch in the road." I would like to acknowledge and thank heartily my dissertation committee, Dr. David Meyer, who is my dissertation advisor, Dr. Catherine Green, who is my voice teacher and academic advisor, and who I was blessed to study with when I myself was going through menopause. I'm sorry, I didn't mean to get emotional. It's menopause. Dr. Rosemary Green and Dr. Jeffrey Marlott, who have held my hand and led me through the maze of qualitative research. Janine Feeney, who was my wonderful copy editor. My family, especially my brother Paul, who is no longer with us. My sister-in-law Kay, and my sister Fran Fox. Angelo Caprilli, my husband, who kept telling me, "You got to get a doctorate. You have to get a doctorate. Go get a doctorate." And most of all, the women who took the time to share their stories with me. I am grateful for their time. Thank you for your interest in my research.